So hello everybody and welcome, and I'll hand you over to Professor Trudy Lang.
That's wonderful, thank you very much. So I'm really delighted to welcome you all to this lesson today. We have a great number of students taking part, and most of you have been really involved already over the last few days. You've had the materials before this course, and there's been a fantastic wealth of discussion between the tutors and yourselves already. I should let you know that we're running this as a sample lesson because we're intending to set up a diploma in global health research through the University of Oxford and the Global Health Network. So we're really using this today to see how well this works, see what you all think, and hopefully this will lead on to us running a diploma over the next few months. So we have thought long and hard about which topic to cover today, and it seems to me that doing this introductory sample session in vulnerable populations is just ideal because it encompasses one of the biggest challenges we find in running research in less resource settings. What we're trying to do with the Global Health Network overall is have a community of practice that works across the globe to try and encourage research in low and middle income countries and places where evidence is missing to change outcomes in health. And that is across the whole research ecosystem, from characterizing diseases, looking at in clinical trials to test new interventions and prevention, and also to roll research findings into practice. And so we believe the whole research ecosystem is incredibly important. So every single aspect of that chain is as important as the other. And our other driving ethos within the Global Health Network is about creating equity to access to research. And that is giving everybody equal ability to take part in research, to run research studies within their healthcare setting, and also for communities to have the benefit of research to generate the treatments and disease prevention and protocol strategies that they experience. And so what we would like to do with this diploma overall is to come up with a course that can help people design really good studies that can be implemented in places around the world where evidence is lacking, but also deliver the know-how for healthcare workers and research teams in those settings to deliver these studies, plan and expedite research in their own healthcare environments. So I won't take the thunder anymore from our wonderful set of tutors that you have today. I really hope you enjoy this pilot lesson that we're giving you, and hopefully over the next coming months you'll hear more about the diploma course that we'd like to develop. So thank you very much for all signing up today. Your participation in this is really exciting and important, and I look forward to hearing how this goes. Thank you very much.
Thank you very much, Professor Lang. So over to you now, Victorine. So there you go, whenever you're ready. Thank you.
Hello, thank you very much. Can you hear me clearly?
Yes, very clearly, thank you.
Thank you. I just changed my headphone. Yeah, I always sample them. Thank you everyone, and welcome to this very exciting 1 hour, I believe it will be. And I would like to thank everyone. Professor Lang, thank you very much for giving everyone this opportunity to, as you say, at the end of the day, be able to achieve equity in accessing research, both as researchers and for our communities as relevant. To the students, thank you very much. It has been an interesting week this far, and this is an opportunity for us to be here together within this 1 hour to share knowledge and also just get clarification on probably the areas that have not been clear so far. We would like to inform you that would like to make it as interactive as possible. Time may be limiting, so we'll try to manage that. This course is about conducting research in global health research in vulnerable populations. One of the questions that I was asked by someone who listened to me talking about vulnerable population is, tell me any research participant who has come to your research center who did not meet the definition of vulnerable. Not tell you what I told them. That's this one, and then with me here today, you have seen Sinead, you have seen Professor Lang. My fellow tutors are also online. That is Ken Kawondo. Ken, I don't know whether you would like to say hi.
Yes, thank you very much, Victorine. I would just like to welcome our students, and for the last 4 days, you have had an interactive chats online, and I hope it's going to be more interesting as we go along. Thank you very much, and welcome everybody.
Fantastic. Welile, if you can hear me, would you like to say hi?
Yes, hello everyone. Nice to have you with us during this live tutorial. Looking forward to interaction. And thank you very much to everyone for the interesting points that have been raised on the discussion forums. It's really been a learning opportunity for me too, and for your fellow classmates. Looking forward to continue to learn from each other for the remainder of the course.
Thank you very much. So as we proceed, let's look at our learning objectives. These are the same learning objectives actually that we had set for the week. Understanding vulnerable populations and why we involve vulnerable populations in research. And then discussing community engagement and a little bit of consent and assent in vulnerable population. You realize that in all this, we are actually incorporating the component of ethics in research. I usually tell scientists that you cannot deliver a scientific research if you do not observe ethics. Those two must go together. And initially they never used to understand me, but I think now it's very clear that if you don't observe ethics, there is no scientific result that you can deliver. So this is a nice picture here. Like I said, this is food for thought. We can tell so much out of this picture. And who is vulnerable? I think over the week, we have had very interesting understandings of who is vulnerable. And we have interacted a lot, both on the voice thread and also in the discussion forum, to understand really who is vulnerable. And we added a couple of different categories into who may be vulnerable, whether they are vulnerable, for a longer term, or it's a temporary situation that is making them vulnerable. But this definition is from the National Bioethics Advisory Committee. And it actually, I like it because it's quite inclusive. It says that a vulnerable person is one who has difficulty in providing voluntary informed consent. And that may be due to either difficulties in decision making, or a situation that they have found themselves into, or the fact that they are at risk of being exploited. So any of those would make a person vulnerable, and especially if they are coming in to be involved in research and we are going to collect data from them, which at the end of the day would use to generalize to make a decision that may affect the world, or better part of the world, then it is important to treat them with a little bit additional caution and measures that have been put in place. And we all know actually that from the historical atrocities, as we call them, that led to the numerous guidelines that we now have, both at international levels, at regional levels, and even at institutional levels. Most of the people who are involved in the research studies can actually be defined as vulnerable. So most of these things that are being put in place are definitely meant to provide protection to the vulnerable population. And this is a list that I had shared for vulnerable population. I will not run through all of it, but I would like to talk about two additional sets of people that I had been asked, I think, during our interaction within the week. And this was street children, whether street children would be vulnerable or not, and who would consent for them. Certainly, a child who is living out of his parents, out of the comfort of his parents' home, is vulnerable. And the fact that it is a child, actually, that makes that person vulnerable. And in terms of consenting for them, who would consent for them, that there has to be someone giving consent, either an adult who has assumed, parenthood for that particular group of children in the street, or a legal person who is advocating for them. But someone will have to give consent on behalf of those children, and they can give assent for them to be involved in children. And like one of us mentioned, actually, this is a category of people that can easily be taken advantage of. You find people pulling them, under a tree and just asking random questions, and then finally doing a publication. And now it's very interesting. Our publishers will not accept a publication if there was no evidence that either consent was taken or consent was waived. The rest of the categories here, I think, are clear. The other category that we discussed a little bit was about commercial sex workers, and the other categories of sexism. So those would be or not, depending on the situation at that particular moment. So those are ones that I would discuss as, when I see the proposal, why they are being brought into the study, and exactly what is happening to them that is making us have interest in studying or in enrolling them in our study. But generally, they would not fit in, their category of vulnerable people if we don't know the background of, why they're being brought on board in a research study. Then we all agree.
Victorine?
Yes?
I'm sorry to interrupt you, but we've had a couple of questions in about the vulnerability of students.
Okay.
For example, are medical students vulnerable everywhere or only in the institute? And yeah, another question, in what circumstances are students vulnerable? Thanks.
Okay, thank you very much. So students are vulnerable normally when they are to be involved in a study where either their professors or senior lecturers have a stake or are interested in. The reason why they become vulnerable is because, just like uniformed people, uniformed forces, students may not be able to say no to their professors, especially if they are professors that they answer to directly. And this is the same person who has an interest in this research and approaches them and says, I have this protocol that I'm implementing, or this study that I would like to implement. Would you be willing to hear more about it? At that point, without thinking twice about it, you would say, oh yeah, I would like to listen more about it. And as you get deep into the discussion, you realize that a student in that scenario would be vulnerable to saying yes and not no, just because of the person who is involving them in research. But there are usually ways that we manage that, and that is where an ombudsman in research becomes applicable. We have used ombudsmen both at the academic institutions and when we are doing research under uniformed forces environments. So they come in and they're actually the people who now interact with the participants and not the researchers themselves, who are already considered senior to the potential participants. So that's what makes students vulnerable. It's not all students, and it is not when students are involved in different types of research. Like, for example, a research institution that is not even affiliated to the university comes and would like to involve students in research. In that case, I wouldn't consider them vulnerable because they are able to make a decision and they have room to say yes or no to the researcher. Any other question I haven't answered, Sunit?
We have lots. But I tell you what, if you want to move on for a few minutes, and I'm just conscious that we have a lot to get through, and I know we're going to have lots and lots of questions. So what we'll do, everyone, is every so often, we'll stop and address the questions as they arise on the particular section. If we don't get to your question during the live tutorial, we will address them all on the discussion forums afterwards. So
yeah,
thank you.
That's perfect. Thank you very much. And as to why we involve vulnerable populations, I think this is very clear, and a number of us already agreed that for sure, if we avoid doing research in vulnerable population, then we will have worse consequences than involving them in our research studies. And truly, researchers do research targeting vulnerable population for all the good reasons, to better understand what is going on, to devise ways to mitigate the situation that is making them vulnerable, to reduce the suffering, and to also accommodate them in the decisions that are made at the end of the day. So if it's a drug that is being rolled out, we do not want to roll it out and expose someone who, a vulnerable population like children in a drug that has been backed up by data that is coming from adults only, or data research that is done and data collected from a different setting, like developed countries with different sets of problems and different sets of diseases, and then expose the people in the tropics with completely different scenarios, with different sets of studies and different epidemiological picture, exposing them to that, because that would give us more problems and would have to start doing research all over again. So we'd like to be more inclusive, include as more relevant as possible the populations that will, at the end of the day, benefit from the product that we are working on or that we are doing research on. And also, there are a lot of research that is done to prevent the situation. A good example that I would give is malaria vaccine. For those of us who have heard about the malaria vaccine, the one that is currently being piloted. This vaccine was tested in several parts of the world. And finally, it is seen to be beneficial to a certain category of people in Africa. And that is because when the research was being implemented out, the relevant populations were involved. And at the end of the day, as much as the efficacy may not be as impressive, and it's actually low compared to what would we usually consider for taking into the market. But there are other benefits to it that have now been echoed and supported, and it's being piloted to see if it can be rolled out in a more meaningful manner. Then to this next slide, just continuing with why we involve vulnerable populations in research. I have actually alluded to quite a bit of this in terms of the consequences that we would face if we didn't do research. And this is an example in children, that if we didn't do research in children and just expose children to products based on adult-only data, we would probably perpetuate harmful practices to our children, or introduce untested practices. And we may fail to develop treatments or new treatments for diseases that affect children only. So that alone is, for me, good reasons as to why we should involve vulnerable population in research studies. I don't know whether there is one or two questions we can answer before we move to community engagement, or otherwise we now move to community engagement.
Victorine, we have loads of questions. Let's see.
Okay.
One, if a survey is being mandated by the government authorities in schools, then can a waiver of consent be given and parents' consent be waived off? Is it sufficient if we take verbal consent or assent from children?
Okay, thank you for that. If it is, I think there's something with my internet. Let me know if it's not coming through anymore. So if that research is considered minimal risk, research that is being done and is not exposing the research participant to risk that they would otherwise be faced with if they were not in the research study, that can be considered. I have seen a bit of that when there is either an outbreak or a problem that is related to the age, school-going age. Normally, the government can request that an intervention be rolled out, and during the rolling out of the intervention, additional data be collected. And normally we collect such data under a research environment with a formal protocol and a consenting process. The only time that consent is acceptable to be waived is when an ethics committee has reviewed the proposal, has reviewed the request to waive consent, and has accepted in writing. So regardless of the case, we must ensure that an ethics committee actually provided a waiver to the consenting process. Normally, one of the things that the reviewers look out for is have you defined your consenting process? How exactly would you like to do the consenting process? And in this scenario, if the researcher envisage that a written consent would either be difficult to achieve, or there is sufficient reason to believe that a written consent will not add much value in that particular type of a study, they must explain that in the proposal, and they have to put it out there to the reviewing team. The reviewing team will look at it, and if they are convinced that it is the right thing to do, they will provide that permission in writing. Thank you.
Thank you, Victorine. Just before we move on, we do have lots of other questions, but one that I will ask is, can we categorize every study among psychiatric subjects as vulnerable population?
I think in my own view, yes, and I will tell you why. When you have psychiatric population, people who are suffering from the different types of psychiatry conditions, they are already incapacitated in one way or the other. And for me, that would make them vulnerable. In that case, we need to approach them considering additional measures because we know that they're already incapacitated in one way or the other.
Maybe linking to that question is another question on the forum about intellectually impaired people voluntarily giving consent after research has been explained fully to them and they have understood it. Would this be acceptable? Is the question from the forum. Victor.
Yes, I can hear you, but I think I lost some point. Could you repeat the question again? Sorry.
So, can't intellectually impaired people voluntarily give consent after research has been explained fully to them and they have understood it?
Yes, thank you for that. So yes, intellectually impaired people can be involved in research. Actually, we do that all the time. Certainly, you have explained that the research is already explained to them. They have expressed understanding and they have provided their voluntary consent, which could be verbal or sometimes we use thumbprint. The challenging thing to that normally is the explanation part. And as researchers, it is important that we ensure that when we are explaining research information, when you're giving a research study information to someone who is intellectually challenged, that we ensure that we are doing it in a language at least that they can understand. We use a low-grade vocabulary so we don't complicate issues for them, and we must actually ensure that there is an impartial witness that is witnessing what we are telling them. So there are these guidelines that have already been laid out on how to conduct research when dealing with intellectually incapacitated people or intellectually disabled people. So once we ensure that we meet at least the requirements in the guidelines, which are the minimum ones, all the times, and I have seen in the discussion forum people sharing what they do in addition to what is spelled out in the guidelines to ensure that before an intellectually challenged person is involved in the study, at least they are sure that this person is coming into the study based on understanding of the study and voluntary consent to participate in our trial and not for any other reason. So yes, we can involve them. What I would like to add is when you have a study where a good percentage, a significant percentage of the participants are illiterate, let me use that term, it is important to ensure that each time they come in, you calmly remind them of a couple of things related to the study, more specifically to the visit that they have come for. If they're coming in for a scheduled visit, it is important to just reiterate to them what is going to happen, and you can talk about what will happen next when they come in again. It shows a sign of respect and care, that you really care, that they understand what they are getting into. Thank you.
Yes, the final one is a participant would like to know if the consent can be waived during epidemic or pandemic like the one we have right
now. Okay, Ken, that is interesting. So like I have indicated before, waiving of consent has to meet certain criteria. I wouldn't say a yes or a no in pandemic. We must describe what we are dealing with specifically. Is this someone who is coming in already too ill to provide consent? Are they coming in with no relatives around that can, provide consent before we allow them in the study? So pandemic on its own, may not be used to consider waiving or not waiving, but we have to describe in our study what we expect as scenarios we expect the participants will be coming into that would justify waiving consent. And like I said, an ethics committee has to review, agree, and approve in writing. Thank you.
Thank you.
So if you allow me, let's move to community engagement. I'll try to go through this one quickly. I think we have spent a lot of time already discussing community engagement because all of us were very interested in it. There have been a couple of questions, and I intentionally responded to the questions by recording so that whoever goes into those specific slides, this one and the next one, would hear all the questions that were asked and the clarifications that have been provided, and would have room to also probably add additional experiences. So community engagement is probably not new with us. What may not be very old is the fact that it is now a basic requirement when setting up research, and has been adopted by a couple of regulators who actually put guidelines or regulations out there for us. And in the recent past, World Health Organization has picked community engagement as a very key requirement. They have provided a lot of information about community engagement, what it means, how to set it up, how to maintain it during the life of the project. And we find it in almost every revised guideline now. Community engagement is being mentioned. And SIOM specifically has given a whole guide on community engagement. So you realize that it's something that is coming up. And when you look at it critically, it is actually a component that we need to adopt as researchers, and everyone else who support research. We need to adopt community engagement. So in terms of definition, community engagement is a process of working collaboratively with groups of people in the development and conduct of research. And these people would be affiliated either by geographic proximity, special interest, or similar situation with respect to what, things that are affecting their well-being. And why community engagement? Like we have seen, for those of us who are able to read or at least pull the provided reading information, there is a lot of information on why we need to do community engagement. And top on the list here is probably something that we are also doing even with ourselves, because now this situation of trying to learn how best to conduct global health research in vulnerable population has made us a community. And each one of us actually has a right to know about what we are likely to get ourselves into and what affects our well-being. So it is important that we engage the community because they need to know what is going on. And one of the reading materials that has been shared is a Code of Ethics from Sun Community. If you read it, you will see how they have expressed the way they would like to be respected. And actually, I think I can identify with it. It is important to feel respected at the end of the day. And the other reason for community engagement is we need to provide culturally appropriate information that can help people make informed decisions to reduce health risk. I have seen a lot of discussions and sharing on cultural differences and how the fact that a particular community has a different culture informed, making amendments to the protocol or the initial idea to make sure that by the time that protocol hits the ground, it will be acceptable to the team. The first time I experienced this is when we had a protocol that was suggesting to run a pregnancy test in from 8 years old girls, and that was informed by the international understanding that a 9-year-old girl can actually get pregnant. So we go to the community and we propose to them, any girl who comes into the study and is 8 years old and above would like to run a pregnancy test. And the elders, actually, that was part of the community advisory team. Our community advisors told us, don't even go there. No one will allow you to run a pregnancy test in the village here for their 8-year-old girl. And actually what they told us is that we will be seen as people coming with bad suggestions to the girls, that you know what, as much as you're 8 years old, there's a possibility that you could be pregnant. So they thought we were going to teach their girls bad manners and expose the girls to information that should not already be given to them. And we had to move that from 8 to 12 actually. And at that point, the protocol was implemented successfully. So it's important to consider the cultural dimensions of our communities. Then, so that the actions that are taken by individuals or families and communities, because those actions affect them, it is important that we engage them in advance when we have an idea before that particular idea is rolled out. So to the next slide, I just pulled out a very nice and interesting definition here about community. And actually this definition helps us understand how complex or how difficult it may be to understand community and also work with a community. And this is a definition by World Health Organization in 1998. Again, for those of us who have gone through the reading materials, you may have come across this particular one. You can read it and please try to internalize it. It gives sort of all the dimensions of a community. And one of the reasons why it's a little complex to define and narrow down on what a community really is. Then these are key points in community collaboration. And in community collaboration, there are different approaches to it. You can approach it from either before, during preparation phases, you're just having an idea and thinking, who should we target in terms of research participants? Who should we target in terms of researchers who will implement the study? Where is our protocol going to be submitted for review? Who should be our partners in this particular idea when we are implementing it? A lot of that is happening right now with the pandemic. Everyone has an idea and you're thinking, okay, so who will I work with? Where will I implement it? Who will even fund it in the first place? So a lot of thoughts and a lot of dynamics happen when you're thinking about collaboration. So this is not just about the actual community where we are going to draw the participants. It is about everyone, all the stakeholders that we are going to work with when we are implementing our idea at the end of the day. So it is extremely important to identify relevant communities, everyone that will be party to implementation of the idea that either an individual has or an institution has or a group of people have. And while thinking about that, we also need to know at the end of the day who will be our local partners. And that is when the ethics committees, the actual research institutions that we are likely to involve, and the actual community where we are going to draw our participants from come in. Then we also need to describe the plans for community consultation, extremely important. If we do not have a plan on how we are going to consult with each other, then it may take too long, and maybe not successful. So it is important that upfront we have plans on how we are going to consult among ourselves, among the community that is at the end of the day being put in place to support an idea. Then in addition to that, we also need to describe community involvement in consenting process. And I saw a very interesting question or comment actually about involving the community in high-level decision-making, for example. How should we define the consent form? How should we design the consent form? What should be in the consent form? I think for the moment, we don't see a lot of that happening, but probably we will get there someday when we are able to do that. But what we do at the moment, which I've also seen a number of us share in the discussion forum, there is already involvement at the local research facility level, and there's already a lot of involvement with regards to ethics committee requirements, because each ethics committee has given out, in addition to the elements that we have in, for example, International Conference on Harmonization, Good Clinical Practice, and the other guidelines that have defined the basic or mandatory elements of a consent form. Every ethics committee has, in addition, provided what they would like to see in a consent form, or what they would like to see incorporated in the process, including making sure that it is not complicated, it doesn't have medical jargon, it is not too long and not too short, and it includes either the 23 or the 25 elements according to the regions where we implement our protocols, and that it is in a language that would be easy to administer to the participants. And if translation is required, that is taken care of. So when we are writing the consent form already, we have different requirements from the local people that usually we include. And I saw a very good sharing about the writing of informed consent document process at a research institution. That was very lovely, actually, that they sit together to collect views, to write it together, to test it, to translate it, and even to make sure that the translation does not the translated document does not distort the initial meaning in the original document. So there's already a lot of that is happening. We need to appropriately understand what is required by making sure that we involve the community in the design and in defining the process, and just make sure that we implement it appropriately. Thank you very much. Then the other one is describing plans for community involvement in the actual conduct. I think that is straightforward. Then plans for access to data and samples. So we need to know upfront who will be able to access the biological samples that we will collect in our study, access them for what purposes, and what can they do with it. Who will be able to access the data, access for what reason, and what can they do with it. And that needs to be described either in a document at a collaboration level. A bit of it usually goes into the protocol as well, like the publication part that defines who would have access to the data, who can publish, what can they publish from a primary objective, from secondary, from tertiary, that kind of detail. And then we also need to describe plans for agreement with the community on dissemination and publication of trial results. Very, very important. It is important to know upfront exactly how we'll approach giving feedback from the research study to the community, and how the data will be published at the end of the day. I would take a question or two from there, if there is. If not, then probably we move to challenges.
Yes, Victorine, we have a lot of questions coming through. Let me see.
Should we proceed? Okay.
Yeah, I think proceed.
Okay.
They're really great questions. I just want to make sure with a little over 10 minutes left that you've time to
finish.
go
Okay.
through your slides, and we'll get to the questions then as much as possible after that. Okay,
Thank you. So I will not spend much time on the challenges. I think the challenges are written all over in the discussion forums, in the comments that were being posted on the voice thread. The challenges of community collaboration implementation are all over. One of the things that I think I've alluded to in my previous slide is the fact that community cannot be defined using just one straight sentence. There are several concepts that have to be considered in defining a community, and we have to pull the correct definition for our situation. Makes it quite complex when it comes to implementing community collaboration. Then time and cost factor. And actually this one, I picked it from just a thought on what normally happens when an idea comes, a research idea comes, a research question comes, up to the time that we hit the ground to initiate the study. There is so much that is involved, and the fact that it is complex already make it difficult to realize the typical community collaboration that we would like to realize. The fact that we really have to be honest and transparent. And it's true, for a research study to be successful, we have to approach it with a lot of honesty and a lot of transparency. When I was very young in trial, I now remember something that was done, and I can say for sure that was unethical. We had a biology student from a university who posed as a villager and came to our research study and listened to the process, the consenting process. And he started asking scientific questions. And I remember the researcher pulling the nurse outside and saying, "Do not consent him." So, now that I think about it, that was an element of not being transparent, because they didn't want to tell the biology student everything that he thought he was seeing in the consent form. They didn't want to give all the explanations about it. I don't see that happening now. That was probably over 10 years back. But I can see that whenever we try to, be dishonest or not to be transparent, it really hits on the process of implementing the study a lot. So all those things coupled together make it quite challenging to realize community collaboration, and also willingness to collaborate. We have, like I have explained, communities with different concepts, being driven based on different reasons. Bringing them together. We have researchers, we have the actual community, we have regulators, we have funders, we have all these different people with probably different mindsets and different intentions, and pulling them together to speak one language. That can be quite challenging. So it is important that when we approach community collaboration, that we ensure that we are ready to handle the actual collaboration and the challenges that comes with it. Here is about the ethical issues that are relevant to vulnerable population. And I usually, just stop and remember the Belmont report every time I'm talking about ethical issues, because I have not seen any one person or any other group coming up with basic ethical principles that are very different from the 3 principles that we read in the Belmont report. We always just go around them, and at the end of the day, the meaning is probably just the same. So thumbs up, of course, to the team that wrote this more than 30 years ago. So respect for persons, beneficence, justice, and non-maleficence are things, four basic principles that if any and every research team can implement, then we would be good enough. And this actually cut across vulnerable, non-vulnerable population. For as long as our research adhere to these principles, we are good. We, of course, can do more, but for as long as we implement the four, we will be in the right direction. And at the end of the day, if our research result is considered scientific, it will also be ethical. Thank you. To this next one, this is just how I think IRBs approach reviewing research proposals that involve vulnerable population. And if you look at the standard operating procedures that different ethics committees use, usually you see that they tell themselves to look at the topic, then ask yourself these questions. Ask yourself these questions. So they ask themselves these particular questions when they are reviewing a protocol. First of all, they ask themselves, what is the type of participants that we are dealing with? Are they vulnerable? Okay, so once you have a yes, then your thinking already changes. You want to see certain things in that particular protocol. You want to see certain level of protection. You want to see certain level of safety assessment, certain level of safety management. So then the second question the reviewer would ask is it appropriate to involve vulnerable population in this kind of a study? Would it not be possible to achieve, to answer the research question using less vulnerable people? If at the end of the day that question is answered as yes, then the last that they would look for is to ensure that adequate protection is put in place. And like I was providing clarifications to one of us, there are guidelines out there that already outlines what a researcher needs to put in place when dealing with different populations. So that is what the reviewer will be reviewing against. It will either be in their SOP or in an international or regional guideline that would guide them on what to look for as an adequate protective measure that is being put in that particular research proposal. And then finally, consent and assent. Consent and assent process is generally a very delicate area. More so when we are dealing with vulnerable populations, it is very delicate and complex because of the different scenarios that we find ourselves in. And a few of them are already listed here: language barrier, the fact that there has to be someone legally acceptable to provide consent on behalf of, for example, a child, or an impartial witness coming in when we are dealing with illiterate people, and just comprehension. I think comprehension is going to be my next big thing. I usually wonder how much do our research participants comprehend when we talk to them about a study. An 11-page consent form in less than half an hour, something they had never heard about. So how much do they even comprehend? And I've seen a lot of interesting discussions on how that is also being assessed in different institutions. And thank you for those insights already. Thank you very much for listening.